So today, just kind of a quick video to talk about a specific topic related to breast augmentation. I alluded to it in the breast augmentation video, but it's ALCL, or Anaplastic Large Cell Lymphoma. And it's something we've been finding out over the last several years related to a specific type of implant. And you may have read a lot about it online, and it sounds scary. And so we kind of wanted to let you know what that's about so that it can help you in your decision-making process. So there's basically two types of implants. There's smooth implants, which is what is in most people, so just a smooth silicone shell, and there are textured implants. There's textured implants that are round like this, and then there's textured implants that are shaped, like these gummy bear shaped implants. All shaped implants are textured implants. What we're talking about, ALCL, has nothing to do with smooth implants. There's been 0 cases involving this at all. But with textured implants, there's been a finding of this ALCL, which is a type of lymphoma related to the texturing of the implants. And the data behind it and the studies into it are suggesting that this texturing process that's on the implant creates these little microscopic indentations in the implant. That was on purpose in the past because we liked that because it decreased rates of capsular contracture. So that's kind of the thinking behind the texturing. In addition to this, with this shaped implant, it was for also the purpose of helping the implant stay in the right position because we don't want it turning because it has a specific shape. So it accomplishes those two elements. But because of those tiny little indentations, the suggestion is that it's allowing a colonization of some bacteria, not an actual infection, but just the presence of it, which then down the road is leading into this ALCL. The rates are various and it changes as the study goes on, but currently, while we're recording this video, the rates for a Allergan implant or a Natrel implant is about 1 in just under 3,000. For a Mentor textured implant, it's about 1 in 50 to 60,000. And for a Sientra or Silamed implant, it's about 1 in 200,000. Obviously very small in some of those types of implants, but a little higher in some of the others. It doesn't mean they're a bad implant. They're a good implant. Allergan makes great implants, but that texturing on that type of implant is very high. So because of that, we're using a lot less or essentially no textured implants. Previous to this, we would use it if someone had recurrent capsular contracture. We'd actually go in and use that type of implant. Now we're just sticking with the smooth silicone implants with the texturing. So a couple different scenarios. So first off, if you came in, would we likely be doing a textured implant? No. If you really wanted a shaped implant, we'd have a long discussion about that. We would use one of the implants that has the 1 in 50,000 to 1 in 200,000 rates. But we'd have a long discussion of whether you really would benefit from this shaped implant or not. I used to love these implants. They really could do it nicely, but now you got to weigh the pros and cons out. So I would say that I personally, and a lot of us, lean away from using these types of implants, the textured implants. But in the right patient, we would consider a shaped one if it really needed it, and once we'd had a thorough discussion about it. What do you do if you've got them in now? Well, currently the FDA has not made a recommendation to prophylactically or preemptively have them removed. So at this point, that has not been the recommendation. It doesn't mean that in the future they could change that, but at this point they have not. They have simply said that if you have symptoms, which here's what the symptom is, some kind of change late stage in your breast. And so usually what it is a late stage seroma, meaning at some point you notice some swelling in the breast. You do an ultrasound and notice that there is a fluid collection. That's a seroma. In that case, at the very least, we would have an ultrasound-guided aspiration or needle suctioning of that fluid. We'd send it off for certain markers and check for markers that are specific to ALCL. If you were to have them, then you'd have the surgery, and we'll talk about that. Other times, someone may just say, hey, I've got this textured implants. It's questionable. There's a little fluid. Just let's go straight to the surgery and deal with it. So other times we would do that. And what the surgery involves is actually removing the implant and removing the whole capsule. So that's a capsulectomy, so the capsule your body made. Then we would take all of that out. We would send the fluid during surgery, and we would send the capsule. That would be evaluated, and then you would know from that fluid analysis and pathology from the capsule whether or not there was any ALCL present. Typically, that is completely curative. if you were to have it. There have been a few situations where it has been detected very, very late, and it's traveled to the lymph nodes and required more treatment, such as chemotherapy. And there have been a few very rare deaths related to this, but it is extraordinarily small. So it is usually something that can be picked up and determined from that standpoint. Allergan specifically does have some, which is the company that has the higher rates of ALCL. They do have some specific rebates and things if someone was to have to go through this surgery that they cover in regard to that. Here at our office, we mostly use Mentor implants and CM-Trip implants. So we fortunately are using the implants that have less of this. But like I said, that's just in the textured implants, and we really aren't using any textured anymore. So once again, to make that real clear, smooth implants, which is by far the vast majority of implants that anyone has in them, and it's essentially only what we are using now, do not have any association with ALCL. So you can feel very comfortable about that. So, but if you have any questions about this, or you're uncertain of what you have in, or that sort of thing, or develop anything that's strange and you just want to check it out, always feel free to call us, whether you're a patient of ours or not, and we can help you decipher that, find out if you do have textured implants or not. We can look that up in the registry, get you some information on that. Some of it can be discussed on the phone just to make things simpler for you, or if necessary, you come in and you see me, we talk about things and decide if a course of action needs to take place. So that's the kind of summary on ALCL, because I know that's kind of a hot topic Google search thing right now. But summary for you, only in textured implants. If you don't have textured implants, don't worry about it at all. If you're coming in to see us for breast augmentation, it's really not an issue at all, because we're only talking about using smooth implants, not textured implants. So that's kind of the summary. But if you have questions, let us know, and hopefully that is helpful.